All right, first things first, go ahead and get that gate belt around. If you don't mind, I put this on you, so keep us all both safe.
Go ahead and
Make sure the teeth are facing out. That way they got to eat that belt. Not too tight on you, it's okay.
put that heel.
Tuck it in there behind. You know, I always like to show this trick too. Again, if you forget, like, if hands are tied, you know, you can't really do anything. You just kind of pull it this way, and that'll help tighten your belt there. So anyway, so this is where we last left off with the patient. Now we want to transfer her from this seated position over to here. And again, you can do weight shifts to get them ready for that weight acceptance, and that'll be good. You can approximate here, all good things to do. We want her to start to lean forward because that's part of the transfer. So I'm going to try some stabilizing reversals. Here, go ahead and push against my hands and stop. Push against my hands. Good. Or hold, don't let me move you. Hold, don't let me move you. Seeing some good irradiation happening there in the lower extremities. So that'll help with that forward to back movement. And then the next aspect we want to work on is that side to side. So we already did the rhythmic initiation. So hold to let me move you. 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 And again, that'll help with that shifting your weight so you can get out of the chair or the bed. So we got those two things going on. You can also do some rhythmic stabilization. Hold to let me move you. Hold to let me move you. Remember, manual contacts and those verbal cues are very important. Hold to let me move you. Hold to let me move you. Okay, so we got all those things wrapped up, and now I think we're probably ready to go ahead and move over to the chair. So I'm going to tell the patient we're going to slide out of the bed here and get closer to the edge. So what I want you to do is lean over to this side, and she doesn't have the strength on this side, so I'm going to go ahead and facilitate that by pulling on that popliteal space. And then I'm going to pull this back just to make sure she's safe. I might approximate here. You can lean onto this side now. And I'm going to guard just to make sure she doesn't fall too much because that's her affected side. Go ahead and scoot this side out. I think we're good here. So we really want to promote symmetry. So go ahead and bring both these legs back here. We're going to transfer over to this weak side. Get that chair as close as you can. And you want the nose over the toes and try to promote symmetry. So I'm going to go ahead and put this hand here. And I'm going to facilitate by approximating. And then if you want them to really focus or emphasize weight bearing on this right side, you can put this other arm over here too. Or you can do it here. You know, whatever your patient can do, that's kind of like what you want to focus on. For right now, we'll go ahead and put it right here. So when you stand up, you're going to go nose over toes, push down on your leg with both hands, and you're going to go ahead and stand up. Another thing you can always do is like kind of help facilitate that sensory aspect by, you know, kind of doing some nice stroking of the arm there too. Okay, so I want to make sure I guard heavily when we stand up, and we're going to promote that symmetry, so I'm going to bring that leg back. And sometimes bringing that leg back might be very difficult because they probably have an AFO on, so they don't have a lot of dorsiflexion when they pull back. So kind of keep that in mind as well. All right, so you don't have to do a lot of weight bearing on that right side. So I'm going to go ahead and block her leg here. So once you stand up, all you got to do is you got to turn to the we're going to go to the strong side. So let me change this up a little bit. This is the weak side, so it's probably working a little bit better for the camera anyway. So we're going to transfer that strong side because initially it's going to be easier for the patient. So now that we've already done all that, so we're going to go ahead and lean forward and push up off there. 1, 2, 3, stand up. Okay. I'm going to go ahead and keep my leg here and to help block that leg because she could easily like give out. So I'm going to be here. That's going to provide a good sensory input. So I'm blocking, so go ahead and step with the left toward the chair. So you got this arm that's kind of dangling here, so it'd be important to probably put it in here, and that'll help make sure that that arm stays safe and not, if you don't have a sling, like a bow bat sling. Okay, now this heel, to get this to move, you're going to put your weight on this opposite side, and then that's going to, you want to put your heel to the midline. So you can just go ahead and slide that forward. You know, I was okay to take my leg away from her because she's weight bearing on this side. So heel to the midline. Now I'm going to block, weight shift. Now step to the left. Yeah. Okay. Go ahead and bring that back here. Okay. Now blocking again, take a step to your left with your left foot there. Now reach back and go ahead and let's sit right down. Good.